When COVID-19 hit Australian shores, Tasmania was quick to act, closing borders to mainland Australia on March 20.
We are going to introduce the toughest border measures in the country. Our aim is to ensure that we protect the health, well-being and safety of Tasmanians.
But the number of confirmed cases began to climb and the state recorded its first 2 deaths in late March. In April, infections have spiked.
On Easter Thursday, we had 103 cases. Today we have 150. The 47 new cases are all linked to the northwest outbreak. This is serious and we need to get on top of it.
The outbreak is linked to 2 hospitals in Burnie. Both Northwest Regional and private hospitals have been shut down to undergo a deep clean, forcing around 5,000 people into quarantine, including more than 1,000 staff.
It is an absolute priority that this clean achieves its objectives to ensure that we have a hospital that can continue delivering safe care for our community into the future.
And the cluster of cases is being firmly linked back to the Ruby Princess. 3 of Tasmania's deaths were passengers on the cruise ship. All were treated in the region.
It's very clear that this debacle has cost lives, and we need to make sure that we're on top of these issues, because in Tasmania, this is an absolute crisis that is emerging there.
This morning, the jump in numbers over Easter was being linked to an alleged illegal gathering.
We thought we were doing really well in the last week, and then we had a cluster of 49 cases in a hospital in Tasmania just over the weekend. Most of them went to an illegal dinner party of medical workers, we think.
An allegation the Premier challenged.
To be frank, Brendan was commenting on a rumour. At this stage, our contact tracing has not identified a dinner party of health workers.
Mid-afternoon, Brendan Murphy rolled back his accusation, saying in a statement, "While this possibility had previously been mentioned to me, following investigations, I am confident it has not occurred. Tasmanian officials are continuing their investigations." So with 2 major regional hospitals shut and frontline workers quarantined, what will this mean for those in the epicentre of Tasmania's COVID-19 crisis?
Well, Senator Jackie Lambie joins us from Tassie's hotspot, Burnie. Jackie, what is the feeling there in northwest Tassie?
The feeling is very, very quiet, I think. I think for the last 2 or 3 weeks we've seen a lot of small businesses close. We're already heading there, so this has been quite difficult. So I think people were sort of getting themselves ready. They were nearly at that lockdown period anyway, so I don't think that's been as bad as knowing what's been going on at the hospital up there, that we now, possibly had 1,200 workers from both the public and the private hospital, which are both joined together up here in Burnie, and that they're now going to be isolating at home, but they've also got other people in the house. So it's a whole new thing for us. So I think it's more fear than anything else down here, because we just don't know enough.
Jackie, with 2 major hospitals being closed, thousands of staff being sent home, how do you feel about the gap being filled? Are you confident it's enough?
I think right now we're waiting for the A&E to be finished getting cleaning, so we can at least get the A&E cleaned up there and get that reopened. In the meantime, the GPs have had their own practices open, making sure that there's any overload that they can deal with that. And I guess this is all the unknown stuff that we're just not going to see what's going to happen in the next 7 to 10 days on having to close this hospital, move patients around, send people home. We're really not going to see the true effect of this for another week or so. And I guess that's where the scary part is.
Jackie, of course, a lot of this, if not all of it, has stemmed from the infamous Ruby Princess. That must be pretty bloody frustrating.
Yeah, I think there's quite a few of us around the country that are pretty angry about that Ruby Princess, that's for sure. And certainly we had 2 or 3 up here in this hospital. And I'll tell you what, they need to be held accountable for what they've done or what they didn't bloody do, to be honest with you. And I'm sure that's coming. And honestly, it should get to the point where there's criminal charges laid.
Well, I know there's an investigation. Do you, as a senator, have any plans to pursue this in some other way?
Yeah, so we've got the Senate Select Committee going there, Waleed, and it's certainly on our top couple of priorities to look at as soon as possible. We'll be in discussion on Thursday, and we're going to start those hearings next week, mate. We're not mucking around with it.
You were, I think, one of the early people to call for a lockdown. Tasmania moved ahead of other states, went into lockdown and isolated itself, closed its borders first. Even with that, though, with the benefit of hindsight, do you think that all came a bit late?
Yeah, I still think it came a bit late, but the other problem is the PPE. We didn't have the equipment, mate, and we probably still don't have the equipment down here. That's also very worrying, and very quiet trying to get information about the PPE, any ventilators in case things do turn really bad down here in the next 7 or 10 days. That's what's really bothering us, and, that's not helping, and we're not certainly the Federal Health Minister is not coming out to alleviate any of our fears, that's for sure. So we'd like to know if worst case scenario happens, and there is more of these health workers are infected and they infect their children and they need a lot more hospital and a lot more medical care. What is their plan? What is Federal's plan to help the northwest of Tasmania out? Because they haven't got days to worry about this. They've got a matter of hours. This could turn really ugly really quickly. Look, it'd be great. And I cross my fingers in the next 10 to 14 days we walk out of this. But if it turns ugly and it turns bad, we just don't have the resources or the equipment down here to deal with it.
And Jackie, just before we let you go, what does life in lockdown look like for the Lambie household?
Yeah, the Lambie household is pretty much flat out, having to do too many interviews with people like yourself.
Oh, sorry, Jackie.
We'll just wind it there, I think, shall we?
Sorry, were you trying to cook or something? Did we interrupt?
No, I've done the cooking. You'll see the soup. It'll be on social media very soon.
That's the important thing. If we can't see it, it didn't happen, Jackie.
Mate, and if someone could send me down a chain so I can put it around my fridge, because I'm telling you, I'll have a bigger rump than Kim Kardashian at this rate, I'll be honest with you.
All right, Jackie, well, all the best with everything. And, we'll watch as things play out over the next few weeks. And, stay safe and hopefully, things are OK down there.
Yeah, let's hope so. Thank you so much.
All right, you're watching The Project. We'll be back in a tick.